Hello, everyone, and welcome back to Dr. Paul's Health and Wellness System, the podcast where we answer your pregnancy questions with simple, trusted medical advice you can actually use. Last week, we talked about food during pregnancy, what to eat, what to avoid, and how the right nutrition can help you and your baby stay healthy. If you missed that episode, be sure to watch it after you're done with today's discussion. I'm Dr. Paul, and I'm really glad you're here. Now, let's talk about a topic that many couples are curious about, but often feel too embarrassed to ask: sex during pregnancy. And many of you have asked questions like, is it safe? Can it hurt the baby? Can an orgasm cause a miscarriage? Is bleeding after sex normal? And when should couples stop having sex during pregnancy? These are questions I hear almost every day, and the truth is, there's a lot of fear and misinformation surrounding this topic. So today, we're going to clear up the myths, answer your questions honestly, and give you practical medical advice that will help you feel more confident and informed. Whether you're an expectant mother, a husband who wants to better support his wife, or simply someone who wants to learn more about pregnancy, this episode is for you. So sit back, relax, and let's dive into today's episode: Sex during pregnancy, the truth every couple should know. Let's get started. Yes, for most healthy pregnancies, sex is completely safe. Your baby is well protected inside the uterus by the amniotic fluid and the strong muscles of your womb, so intercourse won't harm the baby. The only time I advise avoiding sex is if your doctor has identified a medical condition that makes it risky. If you're experiencing heavy bleeding, your water has broken, you have placenta previa, or you've been told you're at risk of preterm labor, always follow your doctor's advice. No, it cannot. This is one of the biggest myths I hear. The penis does not reach the baby. Your baby is safely enclosed inside the uterus, protected by the cervix, the amniotic sac, and the fluid surrounding them. So relax. Gentle, comfortable sex does not injure your baby. No. In a normal pregnancy, an orgasm does not cause miscarriage. After an orgasm, you may notice mild tightening of your abdomen. That's completely normal and usually goes away after a short time. If the tightening becomes painful, regular, or is accompanied by bleeding or leaking fluid, contact your healthcare provider immediately. A few drops of light spotting can happen because the cervix becomes softer and has more blood vessels during pregnancy, but heavy bleeding is never something to ignore. If you're soaking a pad, passing clots, or having severe pain with bleeding, go to the hospital immediately. You don't have to stop just because you're getting closer to your due date. Many couples continue having sex safely throughout pregnancy. However, if your doctor tells you not to, or if your water breaks, then you should stop. Always follow your obstetrician's recommendation because every pregnancy is different. The safest positions are the ones that are comfortable and don't put pressure on your growing belly. Many women find side-lying positions or being on top more comfortable, especially later in pregnancy. After about 20 weeks, avoid lying flat on your back for long periods because the weight of the uterus can reduce blood flow. Absolutely, and that's completely normal. Some women lose interest in sex because of nausea, tiredness, hormonal changes, or simply feeling uncomfortable. Others actually experience an increase in sexual desire. There's no right or wrong. The important thing is for couples to communicate openly and support each other without pressure. If sex becomes painful, don't ignore it. Pain can happen because of vaginal dryness, hormonal changes, pelvic pressure, or even an infection. Pain during sex isn't something you should just endure. Speak with your healthcare provider so the cause can be identified and treated. Sperm contains natural substances called prostaglandins, which can help soften the cervix. But in a healthy pregnancy, sex alone usually doesn't start labor before your body is ready. If you're at risk of preterm labor, your doctor may advise avoiding sex because of this possibility. If your doctor places you on pelvic rest, take it seriously. Pelvic rest means no sexual intercourse and, in some cases, nothing should be inserted into the vagina. Your doctor isn't trying to stop your intimacy, they're protecting your pregnancy. If you're unsure why you've been advised pelvic rest, ask your doctor to explain the reason and how long it will last. Remember, every pregnancy is unique. What is safe for one woman may not be safe for another, so never compare your pregnancy with someone else's. If you ever have pain, heavy bleeding, leaking of fluid, or you're simply worried about anything after sex, don't guess. Speak with your healthcare provider. And to all the husbands listening, pregnancy is a journey you walk together. Be patient, be gentle, communicate openly, and always put your wife's comfort and safety first. And don't forget to like, share, and follow Dr. Paul's health tips for trusted pregnancy advice that helps you have a healthier pregnancy and a healthier baby.